And we're going to be talking about topical anesthetics. Topical anesthetics are a type of surface anesthesia that block the nerve conduction at the surface of the skin or mucous membranes. Only small amounts are needed to achieve results. Penetrates 2 to 3 millimeters into the tissue. It's effective only on surface tissue or mucous membranes. Takes about 1 to 2 minutes to take effect. Concentrations are higher than those used for injection, and it provides 2 to 3 millimeters of anesthesia of the oral mucosa. Topical versus local anesthetic injections will vary by the location and depth of penetration. Topical blocks the nerve conduction at the surface versus the local anesthetic injection blocking it at the field block or the supraperiosteal injection. When we apply topical anesthetic, we are going to dry the tissue to increase visibility and to accurately place the topical. We're going to wipe topical wipe. We're going to use a small amount of topical in the area of needle penetration. Only a small amount is needed. The topical will mix with saliva and can numb the tongue, the soft palate, or the pharynx, so we only want the minimal amount of topical. Topical allergic reactions can happen up to 2 days later. Typically what you might see adverse complications relating to topical anesthesia are just irritation of that area, so that might come on fairly quickly. Stinging and burning at the injection site, sloughing or epithelial disguamination of the tissue in that site of topical placement, or temporary altered taste perception could be a localized adverse effect of topical anesthesia. The most common topical is benzocaine. It's commonly used. It's typically a 20% concentration in dentistry, ranges from 6 to 20%. Rapid onset, it starts to work in as little as 30 seconds. We're going to leave it on there 1 minute. It peaks at about 2 minutes and it lasts for about 5 to 10 minutes total. It comes in gel, liquid spray. Sprays should only be used in metered doses to prevent overdose. So typically you would spray and it would stop when that metered dose was done. Sprays have an FDA warning associated with methemoglobinemia. Methemoglobinemia, if you remember from patient assessment, is a condition where cyanosis develops due to the inability of the blood to bind to oxygen. It has been reported with higher concentrations of sprays, of benzocaine sprays. Particularly unmetered sprays are kind of like the old Aquanet hairspray where you could just spray and spray and spray. That would be unmetered. There's no stopping. So unmetered is not recommended due to the fact that there's no control of the amount of topical that's dispensed. And the benzocaine spray is the topical that has the warning, the FDA warning about methemoglobinemia. With benzocaine, benzocaine is an ester. It has no maximum dose. We'll find as we start talking about the other topical types that there are maximum doses, but benzocaine does not have a maximum dose. Benzocaine can inhibit the bacteriostatic action of sulfa drugs or sulfonamides. Tetracaine hydrochloride has a high water solubility, and it is an ester topical that is the most potent topical. Benzocaine is the most common. Tetracaine hydrochloride, ****, is the most potent. It's the most potent because it's highly soluble in water. It's highly lipid soluble. It's rapidly absorbed into the tissues and has a high risk of toxicity. In fact, they recognize tetracaine hydrochloride as a pregnancy Class C drug by the FDA. So FDA Class C drug related to pregnancy. We wouldn't use this on someone who is pregnant. The next topical is a ketone topical anesthetic, and it's diclonine hydrochloride. It's a ketone. It's in those sucrets. They're in the metal can. I don't know if you guys remember the little metal can. You open up the lid, you take out one of your little round sucrets. I remember those from when I was a kid, specific taste to them. It was kind of a tingly kind of taste. It's not an amide or an ester. It's a ketone by chemical nature. There's no cross sensitivities to other anesthetics. And for those who are allergic to traditional topicals, this is a great alternative. The onset of action is slow. It can take up to 10 minutes to start acting, to start working. But the duration could be up to an hour, 30 minutes to an hour. So it's very slow to start, but once it starts, it's longer than most of our topical anesthetics. It's typically going to be in a solution, available as a diclone solution. 0.5 to 1% solution in dentistry, so it's a rinse. 30 minutes to 1 hour duration, and a 200 milligram maximum recommended dose. Then we've got our amide topicals. Lidocaine is an amide topical that is typically used. If a patient is sensitive to esters, then lidocaine, which is an amide, is used. Most common form is an ointment. It's a 2.5% preparation, has a 2 to 10 minute onset, and a 200 milligram maximum dose. The water-soluble form is more toxic, but overall there's a low incidence of allergies with this as an amide. It's a FDA category B. It enters breast milk in small doses, so category B for the amide. There are single dose topicals. So typically we've got that jar, and we've got that jar in the sterilization room. It's benzocaine, it's 20%. Stick it in there. Like I said, most students come out with gobs of anesthetic on their cotton-tipped applicator, even though they need just a small amount. There are single-dose anesthetics that are kind of like our fluoride is, where it's just a teeny little bit, and it's just enough for a single dose. Those are great. You're going to be very unlikely to have an overdose type reaction because it's a controlled amount. They're less messy. You can monitor the dose. There's no cross-contamination, but they're very expensive. So that's why people don't use them. That would be the only disadvantage to the single dose anesthetic, is that they're more expensive. This amide, we're talking about lidocaine as, you know, potentially a liquid ointment, metered spray, or patch. And we also were talking about the diclone solution as a liquid, and those are nice for someone who gags. So even taking x-rays on somebody, I've seen hygienists use just the rinse and they spit it out and they're numbed, and you can take x-rays on somebody who's a really bad gagger. So it covers more surface area. Patches are nice because they're site specific and they can stay in one spot. It adheres directly to the tissue at the site and they stay in one spot. So the picture here, this dental patch, is nice because it will stay exactly where it's placed. Then we've got Oraqix. Oraqix is great. It's a needle-free comfort, and a lot of patients like this as an in-between type of anesthetic. It is a 2.5% lidocaine, 2.5% prilocaine mixture, so a 5% gel, because if you add 2.5 and 2.5, 5% gel. As you guys know, it has that special blue applicator, and the application is similar to oral irrigation. You are not injecting into the tissue, and I like to show the patients that it's a blunt-tipped applicator, that I'm not going to be injecting, that I'm placing this near the gum line and into the sulcus area. It's applied as a liquid and it turns to a gel as it warms. So it works very quickly too. You inject it around the area, you wait about 30 seconds, and then it lasts 20 minutes. So it lasts on an average of 14 to 31 minutes with an average of 20 minutes. 5 cartridge maximum is important. It's metabolized in the liver as well. Here's just a picture of the application. Then we've got our Amide patch. So our Amide is a prilocaine and lidocaine mixture, patch form, so it's great for that site-specific area. Can penetrate through intact skin, also used to anesthetize skin prior to an IV insertion. It's a breakthrough for surface anesthesia on intact skin. Now, topicals can be in gel form, ointment, cream, spray, liquids, or lozenge. Over the counter, they have Anbesol, so that's like the baby teething agent for pain relief from teething, braces, aphthous ulcers, denture sores, or toothaches. Think about our people who are most likely to suffer from an allergic reaction. The same people that are going to have a problem with a lot of things. Our children, our elderly, and our medically compromised are most at risk for any type of allergic reaction. That includes a reaction to topical anesthesia. More is not better. We want to use it sparingly. We don't want that big gob on the cotton-tipped applicator. Benzocaine is an ester, and some people have ester allergies or sensitivities. Remember the PABA component when ester is broken down. The topical anesthetic with the term hydrochloride, so our diclonine hydrochloride and our tetracaine hydrochloride, mean that there's better, quicker absorption, and that could result in a systemic toxicity in higher doses. So we want to be mindful of that. All right, great job, guys.